doctors who may be refusing government insurance. The Department of Health and Human Services dropping the idea of using undercover mystery shoppers. It was intended to investigate why so many Medicare and Medicaid patients are having trouble finding primary care physicians. Well, analysts say it's tough for Medicare recipients, nearly impossible for folks on Medicaid. Illinois Republican Mark Kirk is on the Senate Appropriations Committee, and he joins us now from the halls of Congress. Senator, thanks for being with us.
Thanks for having me.
Look, you're a lawyer, so you probably know this, that undercover and stealth investigations quite often have the effect of revealing problems. So what's wrong with this one?
Well, it was totally inappropriate because already the peer-reviewed literature demonstrates how many problems we have with Medicare assignment for doctors and Medicaid. But a new program to spy on doctors would probably only accomplish one key objective: forcing many more doctors out of the practice of medicine and trying to force them into some government program that they don't want to be part of.
Well, I read your letter. In fact, I have it right in front of me here to the health secretary. And you argue that, look, there are other surveys out there that answer the very same question. But you'd agree that surveys rely on honesty, and oftentimes undercover operations reveal lies.
Well, I think actually the peer-reviewed surveys are solid. This would have simply repeated work that's already done. And in these deficit and debt times, a waste of taxpayer money. That's why I'm glad the American Medical Association came out against this program. And now apparently the White House has agreed, and they've canceled this doctor spying program.
Well, if Americans were abusing Medicare Advantage, for example, you'd want to know about that, wouldn't you?
Oh, absolutely. None of this is stopping the basic anti-fraud work of the government. But we don't need a government study to tell us that in general the government performs poor work, it's rife with corruption.
But Senator, the reason I asked that question is the Bush administration used secret shopper audits to investigate abuses in Medicare Advantage. So would you have been supportive of that?
I think in this point the doctor data is absolutely clear. It's in the peer-reviewed literature, and this hundreds of thousands of dollars expenditure simply would have been adding a study on top of a number of other respected studies already published. Also, the question would be for investigators that have misconduct, that use this in some sort of a bribery or extortion, how would they discipline them? And I even asked, how did the National Opinion Research Corporation get this contract? Was it even competitively bid? I think for many of these problems, the AMA came out against this program, and now the White House has agreed, no doctor spying program.
Senator Mark Kirk, thank you very much for being with us today to talk about this.
You bet.
Appreciate it.
Thank you.
All right, well, here's a question for you.